Hello everyone, welcome back to the channel. In our previous video, we discussed intentional adulteration and understood how deliberate practices affect the quality and safety of crude drugs. Today in part 2, we are going to move one step further and talk about unintentional adulteration, which is equally important and very commonly seen in herbal medicines. Let's start the topic. Unintentional adulteration means when a medicinal plants get mixed up or replaced by mistakes, not on purpose. This usually happens because people do not have enough knowledge or because different plants are called by the same local name in different places. Let's discuss when there is lack of proper knowledge. When collectors lack proper knowledge, they may unknowingly collect the wrong plant, the wrong part, or collect it at wrong time. Even though there is no intention to cheat, such mistakes results in unintentional adulteration and reduce the quality of herbal medicines. Like many medicinal plants look very similar in shape, size, or leaf pattern. An untrained collector may not know the small identifying differences. For example, belladonna leaves. It may be confused with elianthus leaves because both leaves have similar looking leaves. When the wrong leaves are collected and supplied, it leads to unintentional adulteration. Belladonna, deadly nightshade leaves, come from a highly poisonous plant, Atropa belladonna, in the nightshade family. Belladonna leaves are simple, alternate, ovate to lanceolate, with an acute tip, entire margin, and a slightly decurrent base. Ailanthus individual leaflets are ovate lanceolate with a long tapering end. The margins are mostly smooth except for a few coarse, blunt teeth near the base. The collector does not have botanical training and relies only on appearance. Now, collecting different part of the same plant. Sometimes the correct plant is collected, but the wrong part is harvested. In medicinal plants, only a specific part contains the active therapeutic constituents. For example, in Sargandha, Rauwolfia serpentina, the root is the medicinally important part, which it contains several indole alkaloids such as reserpine, ajmalicin, ajmalin, serpentine. These constituents are responsible for the plant's pharmacological actions. Reserpine produces a potent antihypertensive and sedative effects. Ajmali exhibit antiarrhythmic activity and is used in the management of cardiac arrhythmic disorders. Ajmalins act as a vasodilator and improves cerebral blood flow, while serpentine contributes to the tranquilizing and hypotensive effects of the drug. The leaves and stems either lack these alkaloids or contain them in very low concentration. Therefore, if a collector unknowingly gathers leaves or stems instead of root, the prepared medicines become weak or therapeutically ineffective, even though the plant species is correct. This clearly illustrates unintentional adulteration due to lack of proper knowledge during collection, leading to reduced potency and compromised therapeutic efficacy. Now, collection at the wrong maturity stage. Now, let us understand how collection at the wrong maturity stage causes adulteration. You see, the medicinal value of any plant depends very strongly on its stage of growth. If a plant is collected too early, that is, at an immature stage, the active constituents are not fully formed. On the other hand, if it is collected too late, when the plant is over matured, the active constituents may start degrading, oxidizing, and converting into inactive forms. In both cases, the crude drugs may look genuine in appearance, but chemically it is weak. It contains a lower amount of active principles and therefore fails to give the desired therapeutic effect. That is why such material is considered inferior or adulterated, even though there is no intentional mixing. A very classical example of this is digitalis leaves. Digitalis purpurea and Digitalis lanata are important medicinal plants, and their leaves are used as a crude drug. These leaves contain cardiac glycosides like digoxin, digitoxin, which are used in heart diseases or disorders. For best Quality. Digitalis leaves should be collected during the second year of growth, especially at the beginning of the flowering stage, because at this time the glycoside content is at its maximum. If the leaves are collected too early, before flowering or during the vegetative stage, glycosides biosynthesis is incomplete, resulting in low potency of the drug. This may even require higher doses and increasing the risk of toxicity. If the leaves are collected too late after full flowering or seed formation, the glycoside begins to decompose due to enzymatic action. The leaves lose color, become brittle, and the drug becomes pharmacologically weak. So, even though the correct plant or correct plant part are collected, the drug is still considered adulterated because it does not meet pharmacopoeial standards. This type of adulteration is unintentional and mainly occurs due to lack of knowledge and careless harvesting. Here, collection of crude drugs in the wrong season. Now let us understand one very important reason for unintentional adulteration, that is collection of crude drugs in the wrong season. In medicinal plants, the quantity and the quality of active constituents do not remain the same throughout the year. The production and accumulation of chemical constituents such as alkaloids, glycoside, tannin, resins, volatile oils all depends on climatic conditions, rainfall, temperature, sunlight, and stage of plant growth. Therefore, each medicinal plant has an ideal season during which the active constituents are present in maximum concentration. If the plant is collected before or after this optimum period, the drug becomes inferior in quality, leading to adulteration. Here, the example of senna is given. Like senna leaves should always be collected during the dry season because this is the time when the leaves are fully mature and the amount of sinusides, the active laxative constituent, is at its highest level. During this period, the leaves remain dry, green in color, and intact, which means the medicinal quality of senna is at its best. But the problem starts when the senna leaves are collected during the rainy season. Because of excessive moisture, the normal formation and stability of sinusides get disturbed, and the rainwater can even wash out these water soluble constituents. As a result, the laxative effect of senna becomes weak and unreliable. At the same time, rain makes the leaves very soft and fragile. So during harvesting, they easily tear, curl, or break, and they lost their typical shape and appearance. If the leaves remains wet for a longer time, you will notice discoloration, such as yellowing, browning, or even black spots. These changes clearly indicate deterioration, and such material is usually rejected according to pharmacopoeial standards. Moreover, the high humidity of the rainy season creates ideal conditions for fungal and microbial growth, which can lead to mold contamination, means white, gray, or powdery patches on plants, which is shown in the figure. So remember, even though these analyses are obtained from the genuine plant, they are still considered adulterated because they contain less active constituents, do not meet official quality standards, and show both physical and chemical deterioration. This example clearly teaches us that adulteration does not always mean adding foreign substances. Sometimes it simply happens due to wrong collection practices, especially collection in the wrong season. Due to the difficulty in proper selection during the rainy season, collectors often end up mixing damaged leaves, insect infested leaves, and partially decomposed material along with the genuine drug. Although no harmful or foreign substance is deliberately added, this careless mixing lowers the quality of the crude drug and results in adulteration. Regional naming differences. For example, in one area, a plant may be known by a particular name, but in another area, a different plant is sold using the same name. For instance, in different parts of the country, the name Parpata does not always mean the same plant. Ayurveda recognizes Fumaria parviflora as the true Parpata, commonly used and supplied in North India, especially in states like Uttar Pradesh, Rajasthan, Punjab. Fumaria parviflora contain isoquinoline alkaloids such as fumarine, and protopine. These alkaloids are mainly responsible for its liver protective, blood purifying, antipyretic, and anti inflammatory activities. Plants like Aldenlandia corymbosa and Moluga pentaphylla are also sold under the same name as in some regions. Aldenlandia corymbosa, sold as parpata in parts of South India, commonly encountered in Tamil Nadu, Kerala, Karnataka, and adjoining regions. Also used in Siddha and folk medicines, and is rich in iridide glycosides, flavonoids, and triterpenoids. Contains fewer or no isoquinoline alkaloids. This plant mainly contributes to antipyretic, anti-inflammatory, and digestive properties. Because its active compounds are free from Fumaria parviflora, its therapeutic action is not identical. Similarly, Molugo pentaphylla used as parpata in some central and eastern parts of India, as reported from Madhya Pradesh, Odisha, parts of Andhra Pradesh, and local tribal markets. Often collected from the wild due to similar habit and appearance, it lacks the characteristics alkaloids found in true parpata. Although all three plants are used medicinally, their chemical constituents are different. Therefore, when Aldenlandia corymbosa or Molugo pentaphylla is used in place of Fumaria parviflora, the intended therapeutic effects may not be achieved, leading to unintentional adulteration. So, an untrained person may accidentally collect the wrong plant, even though no one is trying to cheat. These mistakes can still be dangerous. They can reduce the medicine effects, lower its quality, and may even cause health problems. So, students, whether adulteration is intentional or unintentional, the result is always the same. That is, the loss of quality and risk to patient. Intentional adulteration is done for profit, while unintentional adulteration happens due to lack of knowledge, careless collection, or wrong practices. That is why learning these concepts is important, not only for exams, but also for your future role as healthcare professionals. As students of pharmacy and life sciences, your awareness and honesty can protect public health. Always choose knowledge, quality, and ethics. So, listeners, this brings us to the end of today's topic. We will meet again with a new and interesting topic in the next video. Till then, take care, stay blessed. Thank you so much.